Good day, Kahnawà, and welcome to our first update from Public Health and Safety. As part of the ongoing recovery phase of the pandemic, we did mention we will do periodic updates on public health and public safety measures in the community. I'm glad to say things are still on the right path to recovery. We're on the path to get back to a state of normalcy as quickly as we possibly can. We do have a plan in place. The plan is rolling out over the next several weeks, and I'll get into the details in just a minute. But first of all, I'm here to officially announce that tomorrow, phase 4 of the reopening plan will come into effect. And as of tomorrow, Kahnawà will be officially moving into the green level alert. The green level is our lowest level alert for the pandemic. But we also have to keep in mind, even though it's green and it is the lowest level, that does not mean the pandemic is over. Things are doing very well in Kahnawà. Things are doing very well across the country and around Quebec and Montreal area, but we have to still remain vigilant, and green does not mean over. I want to make that point very clear. And if you look at the measures in Kahnawà in green, they are much less than Quebec. Even in Quebec, they have a green level alert, but they still have some pretty strong measures in place. So I just wanted to say that to make sure that we're very clear. But at the same time, part of the recovery phase, we are certainly on the right track. And as I said, as of tomorrow, we are green, and we are going to be rolling out phase 4 of the reopening. And that includes many elements. A lot of them impacting businesses in the community, such things as restaurants, the cigar lounges, bars, and social clubs will be able to have operations that will be at 100% of their capacity. But 100% capacity is based upon distancing measures must still remain. Distancing measure at this point is still a public health measure that needs to be followed. But they are able to expand 100% capacity based on those distancing rules, as well as from the public health and safety perspective, we are no longer limited in the hours of operation for any business in the community. They will now be subject to the pre-pandemic rules. For example, for the alcohol sales, the ABC law will dictate and give the hours of operation for bars and social clubs, as well as the gaming law will regulate the hours of operation for the gaming establishments. So that's one measure that's going to be reduced. As well as some of the measures in place for restaurants and households. We'll be posting this information more specifically, but for restaurants, bars and social clubs, it's going to be tables will be limited to a maximum of 10 individuals per table. Rather than looking at individual households, we feel comfortable with moving forward and saying a maximum of 10 people per table. Again, distancing in between individual tables as well. Gyms and fitness centers as well can operate at 100% capacity, maximum of 25 people. Again, distancing and such must be maintained. As well as private events and social activities in rented halls and indoor settings. So if you're planning you want to rent a hall and such for various activities, such as a meeting or a conference or stuff, that's still capped off at 50 people, and people must remain seated. At this point in time, renting a hall for a party of some sort or a celebration is still prohibited during this next phase. But if people need to have a larger space to meet, that is something that is possible to take place. A lot of information coming out today, and to look at the next part of the measures that will come into effect today. Lisa is here to talk about the public health side of those measures, and we're glad to introduce some easing of those areas as well. And I'll turn it over to Lisa at this point. So thank you very much, Kahnawà, and keep up the good work.
Good morning. So a few things that I wanted to mention today, just off the bat: vaccination. So we presently are having a walk-in vaccination clinic at the bingo hall, both for Pfizer and Moderna. So of course, it could be for your first or your second dose. If it's for your second dose, it has to be at least at an interval of 21 days for Pfizer and 28 days for Moderna. And it is until we no longer have any doses available. So there still are a few doses left of Pfizer and more doses left of Moderna, but we urge you to go to the vaccination site today, because it is the last day of vaccinations for the next month. And after today, the bingo hall will be closing and we will be relocating the vaccination site. So firstly, I would like to say a really huge thank you to all the staff at the bingo hall for all of their hard work, for allowing us to use the space. It's been really a wonderful experience, and so thank you for that. Thank you as well to the MCK staff, to the KMHC staff, to the fire brigade staff, to all the staff at the bingo hall again, as well as to the task force staff who have worked hard at the bingo hall to ensure that the vaccination site can meet the needs of the community. It's really been wonderful. So after today, the bingo hall will close to the vaccination site, and we will relocate the vaccination site to the arena, where we will hold the next vaccination date. So as you know, as we've already released, the next vaccinations are at the end of July and early August, and those are for second doses for Pfizer and Moderna, but we'll give more information as we get closer to those dates. In between today and the end of the month, we will not be vaccinating. So that's really important. If you can go today, walk-ins are being accepted. Just a quick note about vaccinations as well. Second doses are extremely important. We're doing really well right now. If you look on TV, you look at the hockey games, you look all around you, it seems like COVID no longer exists. However, it does. And in order for us to avoid as much as possible a fourth wave come September, in order for us to return to school as normally as possible, in order for us to maintain these freedoms that we're experiencing right now, second doses are really important. One dose is not enough to protect us in the long term, although it's working well right now. So if you haven't had your second dose, I really urge you to do so today or at the coming vaccination clinics. Another thing that's important to note is that once our vaccination sites completely close, you will have to go to a walk-in site outside of Kahnawà for your second dose. And second doses are going to be required, or are going to definitely facilitate travel as well. So there are many reasons why second doses are important, but first and foremost for our utmost protection. So yes, we are happy to announce some changes in public health measures, specifically with respect to distancing and masking. And it really is just guidelines that we want to provide to you, because we do get a lot of questions on a regular basis about whether we should mask or distance in certain situations. So there is a release, a really great chart that's going to be released today. Maybe we can put it up on the screen about when or how you should mask or distance in certain situations. Again, these are recommendations. We give the best recommendations possible so that you can feel as safe as possible and be able to make your own decisions. So, of course, when you're outdoors, you're a lot more safe than when you're indoors. Outdoors with a small group of fully vaccinated individuals, or in a private home in your backyard, so where you know who you're with, you don't need to mask or physical distance. Of course you can, and no one will fault you if you do. So if you're a vulnerable person, if you're feeling anxiety, if you want to keep your mask on, you can. However, it's not necessary if everyone is comfortable. And that is whether you're vaccinated or not in those small environments. Those are decisions for you to make now on a personal basis. If you're, and what would facilitate or help you in making your decision is whether you're in a small group with people that you know, that you're able to discuss with them, whether people are vaccinated or not. But when you're in a large group where you don't have control and you don't know who's around you, if you're not vaccinated, we suggest that you keep your mask on and that you keep distancing. And if you are vaccinated, then of course masking and distancing is not required. So this chart will help you. It's going to be posted on Kahnawà 911. We still recommend in workplaces that you maintain your mask, and of course this is required in health and social services and our community organizations. If you're again in a private setting, those are personal decisions for you to make, whether you feel safe, not safe, whether you're vaccinated or not vaccinated, and this chart will help you make those decisions. We're also today going to be releasing our second version of the current public health measures, so as of July 1st. And what you're going to see in that document is highlighted sections of changes, and we'll continue to do that on a weekly or bi-weekly basis as changes occur. So one of the major changes that we want to announce to you today for public health measures is that runny nose and or congestion is no longer considered to be a COVID-19 symptom. This is especially important for school, for daycare, for the day camps. If your child has a runny nose or congestion, they can still go to daycare, they can still go to camp, well, of course, as long as they're feeling well, but it's not, they don't need to stay home and be tested any longer. I think that this will be a huge relief to many families and parents who have missed a lot of work time because of that symptom being considered a COVID-19 symptom. So that's a huge change to our symptom logs. So when you assess your own symptoms on a day-to-day basis, as we still should be doing, runny nose is not considered a COVID-19 symptom. I think that's the major change that we want to present to you today, besides the masking and the distancing measures. Lastly, I wanted to talk to you about visitation at KMHC, at TBEL, at ILC. There are changes occurring as of Monday to visitation, and we're really happy to be able to share these with you today. So, in a patient's rooms, no matter the location, 3 people maximum is 3 people from 3 different households is the maximum number of visits in the room. However, if you are a group of people all from one household, then that is acceptable as well to be in the room. So as of Monday, children will also be allowed to visit. No appointments are required in any of the 3 locations. However, what is extremely important is that the registry be kept up to date. So when you come into any of the buildings for visits, or when you leave, you will have to sign in and sign out. There are also, it is also really important to transmit to anybody who visits safety, public health requirements while in our buildings. So again, masking, hand hygiene, all of this is important. So when you come into the building, you will be asked to watch a video a very, very short video that will explain to you what the public health measures are. And we will expect that they be followed when in the buildings. We still have guidelines to follow because we still can transmit COVID into the residences, and it can still be a risk for many of our vulnerable populations. So we have to still maintain certain rules in place. You're now allowed to eat in the room with your loved one. We ask that you put your mask back on once you're finished eating, but you can eat. You can bring in food. You can bring in things for your loved one as you'd like. You're also allowed to sit in the common rooms. So we still can't move from room to room or all over the floor of the unit, but you can accompany your loved one from their room to the dining room. You can sit with them while they eat. This is acceptable as long as we haven't exceeded the limit for the space. So we're only allowed a certain amount of people in the space so that we can maintain distancing, as is the case in all of our measures that are in place currently. Residents can also be, and this has been the case for a little while now, but residents can go for walks with their family members or loved ones or friends. They can go out on day passes. They can go to restaurants. They can go for walks. They can also, with doctor's permission, go have passes available. So these are things to discuss with, of course, the physician, with the nurses on the floor for KMHC in particular. So we're really happy to be able to move forward with these measures. This is huge. This is opening our doors more so than we have since last March 2019. I think, yes, almost 2 years now, or a year and a half. So it's a huge change, and we're really thankful that you have been patient as long as you have, and that we have all worked together to keep our most vulnerable safe. None of the residents in any of our 3 establishments have had COVID-19. So this is quite something when you look at the statistics across Quebec. So thank you for that, and we hope to keep it that way. So please be patient with security when you come into our buildings, and ensure to follow all of the measures that we're requesting of you so that we can maintain safety at all times. So thank you, and we'll be back as we have more changes.